My name is Caitlin Casamatis, and I am a second year medical student at the University of Missouri. I worked on this research project with Dr. Aaron Gray as my mentor. Our project was 4,834 college students' COVID 19 prevention beliefs and practices. In late 2019, a novel coronavirus that generally presents as an acute viral respiratory tract infection was first identified in Wuhan, China. Coronavirus disease 2019 quickly spread to other countries around the world. On March 11, 2020, the World Health Organization characterized coronavirus disease 2019 as a pandemic. As colleges and universities resume classes, it is important to understand students' beliefs about COVID 19 prevention and how they practice preventative measures. This survey was designed to assess beliefs and practices on COVID 19 prevention among college students in the United States. For our methods, an online self administered survey was developed which collected information on COVID 19 preventative practices and beliefs. Eligible participants included undergraduate students ages 18 years and older enrolled for the fall 2020 semester at the participating university. Survey responses were collected between July 13th, 2020 and July 31st, 2020. 4,834 out of 21,128 students consented to participate and met inclusion criteria for a response rate of 22.9%. Bivariate relationships were determined using the two-sided chi-square test for association and Fisher's exact test, where appropriate. Significance was set at less than 0.05. This is a breakdown of responses from our demographics questions. We had more responses from females, people who lived in larger towns, and people who are white. In general, female students followed CDC COVID 19 preventative guidelines more closely than male students. Since March 2020, 52% of females versus 44% of males have always worn a mask or face covering when going to a grocery store. 31% of males versus 18% of females were not worried about personally catching COVID 19, and 11% of females versus 18% of males had become much less worried about catching COVID 19 over the past 3 months. There were 70% of females versus 63% of males who answered that they always or often try to stay 6 feet apart from people who are not family or roommates when out in public. On the topic of hand sanitizing, 74% of females versus 56% of males think that it is very important to frequently wash their hands with soap and water for at least 20 seconds or use hand sanitizer. Overall, students who reside in areas of larger populations have more strict COVID 19 prevention beliefs and practices than students from areas with smaller populations. There appears to be a decreasing pattern of concern of COVID 19 in areas as population size decreases. Asian and Black or African American students predominantly adhered closer to CDC COVID 19 prevention guidelines and had stronger beliefs for infection prevention measures than white or American Indian or Alaska Native or Native Hawaiian or other Pacific Islander students. Hispanic and Latino students were more stringent in COVID 19 prevention beliefs and practices than non Hispanic Latino students. In general, white, non Hispanic Latino students followed CDC COVID 19 prevention guidelines less than other race and ethnicity groups. Based on our results, societal gender norms likely play a role in the sex differences observed in this study. Differences in preventative practices between individuals in rural and urban communities may be influenced by several factors, including local policies and transmission rates, as well as health literacy. Increased awareness of racial disparities in COVID 19 outcomes may have made preventative practices more of a priority to ethnic and racial minority students. This study concluded that significant differences exist in COVID 19 prevention beliefs and practices in college students based on sex, size of town in which one lives, race, and ethnicity. Interventions designed to educate college students on effective ways of reducing their risk of COVID-19 infection should take into consideration these differences. This study showed several areas of significance. A common pattern seen among all demographic groups was a greater concern for family members catching COVID 19 than contracting the virus themselves. This concern for morbidity and mortality among older family members may be used as an important teaching point when discussing COVID 19 prevention among college students. By emphasizing the importance of preventing viral transmission to family members, college students may be encouraged to reduce their own risk of COVID-19 infection.